Hi guys, it's Dave. Today we're going to talk just a little bit about antipsychotics and their use. I literally, like I said on the antidepressant video, I could talk for hours on this. There are so many different drugs. There's so many different things with them. Make sure you talk to your provider or pharmacist regarding all the different side effects for the different types of antipsychotics that you might be on. Antipsychotics are used for people that are having problems with psychoses. It can be a short-term issue. However, a lot of these people deal with it on a long, lifelong battle. They work by actually lowering the level of dopamine by helping to block that in your system. So people are able to more focus on their reality instead of voices that may be happening, delusions that may be happening, things that may be appearing to be real to them, but truly are not really going on. There are actually two different types of classes. There is the typical and the atypical. The typical is the older class of antipsychotics. They're associated with more side effects and more severe side effects. Both classes of antipsychotics, the typical and the atypical, you can see drowsiness and dizziness. You can see movement disorders like tardive dyskinesia, where your hands are trembling, you may get the lips moving, you may not be in control, kind of looks a little bit like Parkinson's disease. Something else you can see is weight gain, dry mouth. An increased prevalence in diabetes can occur with long-term use, so you want to make sure you're monitoring your blood sugars with that. Also, with the sedation, you want to make sure that you're careful if you're working around heavy machinery or driving, especially if you're first starting out. You want to watch out for that because you don't want to get in a car and have something bad happen with you on that. The other thing that you can see is, of course, just a weight gain not based on the diabetes. So you want to check in if you're seeing a huge amount of weight gain occurring, talk to your provider with that as well. Again, that's mainly seen in the typical, the older generation like Haldol, as compared to the newer generation, the atypical, like you will see with Seroquel, risperidone, Invega or paliperidone, ziprasidone or Geodon, plus many others. With these types of drugs, you can take them on a daily basis. That will keep you in best control. And with a lot of them, they actually come in an injectable form that you can use that will last a longer period of time. So instead of taking it every day, you might be able to get one injection in the doctor's office or at the pharmacy that will last over a month or sometimes even more. They are more costly, they're way more expensive. Some insurances will be a hassle. You might need a prior authorization, they may not cover it. But for you, it may be easier to go visit your doctor or your pharmacy once a month instead of taking that pill every day. At least it would be easier to remember. Not all of them are like that, but many of them are. So again, check with your pharmacist or provider about that. Some of the other things that you want to be aware of. In the elderly patients, people over the age of 65, they really aren't good drugs to be on. However, as I've said in the past, there are situations where it's the only thing out there, and if we want to keep them from hurting themselves, harming others, having something bad happen to them, an antipsychotic may be the only thing there is to do. But if that's the case, we want to make sure we're on the lowest dose possible. When you come onto an antipsychotic, they will taper you up, hopefully, starting at the lowest dose possible, see how you do with side effects, and again, see how much it will take to actually help you to take care of the psychosis. When you come off, if you ever need to come off, they will also want to taper you down. So if you're on, like, say, 300 milligrams of Seroquel every day, They would want to drop you down to 250 or 200 milligrams for a couple of weeks, and then go down to 150 to 100 for a couple of weeks. It may take several weeks, even months, to get up to where you need to be, or to come off down to where you need to be. We do have a lot of questions about, well, should I be on an antidepressant with an antipsychotic? You can absolutely be on an antidepressant or an anti-anxiety medication or a mood stabilizing drug and an antipsychotic. Talk to your pharmacist about any drug interactions that there may be, because there definitely can be drug interactions between those meds, especially looking at dizziness, drowsiness, sedation, those kinds of things. Also weight gain, weight loss with those. But you can be on antidepressants, mood stabilizers, antipsychotics, and anti-anxiety meds at the same time. The lower the dose, the better, but you can be on those. Kind of a little tidbit I want to tell you about. If you are a smoker, it's best if you can quit smoking for your overall well-being, but also if you're on an antipsychotic, you may require higher doses, because when you smoke, the nicotine actually helps to break down that antipsychotic faster than someone who doesn't. So what that means is you're getting the drug to go through your system faster, but not necessarily helping you. So they would need to raise the dose to get you on a dose that would effectively control your condition. So if you can quit smoking, they would be able to give you a lower dose, which would provide less side effects. So if you're smoking now and on an antipsychotic, absolutely, if you want to quit, let your doctor know that, because they may need to lower your dose, which would be a good thing. The other thing that I want to let you know is if you are a heavy coffee drinker, 1 to 2 cups, not going to see much of a difference. But a heavy coffee drinker, it may actually cause you to need a lower dose, because the coffee doesn't allow the antipsychotic drug to be broke down as fast as somebody who doesn't drink coffee. So maybe not a great reason to start coffee, but it may allow for you to be on a lower dose. If you're starting an antipsychotic, let your doctor know about your coffee intake. Or if you're starting to wean yourself off of coffee or drinking more coffee, let your doctor know that as well, because that may need you to be adjusted on your dose so your doctor has a heads up. Otherwise, they're going to be going blind as to maybe why this drug is not working like it used to, or why you're having more side effects than you used to. It could be because you're drinking more coffee or less coffee, or you're trying to quit smoking. So make sure you let your providers know about that as well. Hopefully this has answered some of your questions. Like I said before, there are a lot of things with antipsychotics. Make sure you talk to your pharmacist or provider.